Alright, so I'm gonna do the 360 camera. Clear, nothing there. Up, down, and this is my equipments. Those are measurements. There we go. Right here. 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 Okay. All right. Hi there, my name is Mel Nolasco. I'm the United States University student for NP. Today is the September 8th, 2025, and this is the patient Roseanne. Miss Roseanne, so I'm gonna get a consent from you. I'm gonna do a cardiac examination or cardiovascular examination. Is that okay with you?
Okay.
So I'm gonna do a head to toe thorough examination, and also we're gonna post this YouTube this video on YouTube and put it as unlisted. Is that okay?
Okay.
Okay. All right. So I'm gonna start with explaining the blood pressure. Okay. So for the blood pressure measurement, I'm gonna check her bilateral arms while sitting down or while on supine position, and when she's standing up. I'm not gonna check her right now. So we're gonna check the blood pressure, make sure the measure and compare the differences. When you check the blood pressure, make sure you have the patient sit on the chair, have her or him at rest for at least 5 minutes. Make sure the feet are all together and placed on the floor. Make sure you get the right size of the cuff, or else you're gonna get a false blood pressure reading result. Also, make sure you place the blood pressure cuff at the fourth intercostal or the PMI for the accurate result. You don't put the blood pressure cuff too high to get the lower reading, or too low to get the higher reading of blood pressure. And then we'll start. So I'm gonna have you lay down. Alright, so for the first one, for cardiovascular examination, first you inspect, and then we're gonna measure the right interjugular pulsation. So you're gonna have place the patient on 30-45 degrees. You put a pillow under her head, and then have the patient look on the left. So as you inspect, there's no abnormal pulsations. However, you're going to see a little bit of or a moderate pulsation, so you can find the jugular vein. So for the jugular vein, you see the pulsating area right there. You're going to use or measure with the 3x5 card. So this is right here. You're going to put a ruler on the suprasternal notch. So there's the pulsation right there. Right there. Sorry, I'm going to put a little pressure on it. So this is about 2 centimeters. Normal jugular vein measurement is less than 3 centimeters. So that is good. For the jugular vein measurement. And for this one, I'm gonna have put the patient on the left side again. I'm gonna I'm gonna inspect for the carotid pulse, and I'm gonna palpate it. So usually the carotid pulse will be found on the third lower neck. So it's right here. Are you okay?
Mm-hmm.
All right. So I feel the pulsation there of the carotid pulse. The amplitude is about +2. That is normal. There's a delayed and brisk for with the speed. Also, you never measure both of the carotid pulses. It's because it impedes or decreases the circulation to the brain. So after palpation, I'm gonna auscultate for the carotid pulse. Using the diaphragm, I'm gonna ask the patient to hold their breath for 10 seconds. Hold your breath, 10 seconds. I'm gonna place the diaphragm on your carotid pulse. You should be hearing the pulsation of the carotid, but I don't hear any bruit sound or swooshing sound. So that is normal. So as I go downward, I'm gonna check for the chest wall abnormalities. Is it okay, professors? I'm just gonna adjust this so you guys have a better, can see it better. Okay. So for the chest wall abnormalities, it is symmetrical. There's no obvious trauma, no flail chest, nothing like that. I'm gonna ask the patient to roll the drapes out or their shirt up just a little bit. Okay, right here. So as I'm inspecting, there's no precordial or apical pulsation. There's no obvious pulsation. And then for the PMI, usually it is the apical pulse, so I'm gonna have the patient roll on her left side, so it is gonna be a left side lying position. So I'm gonna make a ball of my hand and put it on the PMI or left mid-clavicular fourth intercostal space. I'm gonna check for any thrills. So I'm gonna ask the patient, roll on the left side, hold your breath. Ball fist, negative for any thrills, and I place my hand flat. Sorry, my hand is cold. And it's negative for heaves. As I'm palpating right now, I don't see any obvious enlargement of the ventricles. So I'm gonna put you back on the back on it. Lay back down. So I'm gonna put the shirt up again. I'm gonna inspect for the abdominal aorta. So for abdominal aorta, I'm gonna palpate on the epigastric area, towards to the left slight. Deeply palpation. So there's no mass. There's no obvious pulsation. So which is good. The normal measurement of the aorta, abdominal aorta, is less than 3 centimeters. So since I'm here already, I'm gonna auscultate for the abdominal aorta. I'm gonna listen with the bell. Renal artery, right side, left renal artery, branches off the left iliac artery, right iliac artery, and then right side femoral artery, left side femoral artery. So upon auscultation on the abdominal aorta and the branches of the arteries, renal arteries, iliac, and femoral, there's negative for bruit. I didn't hear any swooshing sound, which is good. That is good. And then next is I'm gonna listen to the 5 heart sounds or heart sounds for the auscultation. So I'm gonna use the diaphragm and both diaphragm and bell for listening to the 5 heart sounds areas. I'm gonna start off with the diaphragm. So this is the aortic area. It's gonna be on the right second intercostal space. This is the pulmonic. It's gonna be on the left second intercostal space. And this is the Erb's point, which is at the left third intercostal space. And these we're gonna hear the S1, splitting of the S1 and S2. Usually you will hear it at you best heard it upon inspiration. It's because of the S1 is the closing of the aortic valves, where it increases the venous return to the right side of the heart that goes into ventricle, right ventricle, and it decreases the intrathoracic pressure, and then the S2 closes, which is the pulmonic valve. And I'm gonna go ahead with the tricuspid valve, which is at the left fourth intercostal space. And then the mitral valve, heart sound, which is at the left fifth intercostal space. So after the diaphragm, I'm gonna use the bell. This is the right second intercostal space for the aortic. And then the pulmonic, left second intercostal space. And this is the Erb's point, which is left third intercostal space. And then fourth intercostal space, tricuspid. And then fifth intercostal space, mitral. So those 5 heart sounds are normal, +2 for the amplitude of the strength. No bruit sounds, negative for any swishing sound. It's pretty good. Okay, so now I'm observing and examining the extremities. No edema, no varicose veins, no shunts, such as dialysis patients. I'm checking for the cap refill of the both arms, upper arms. Put a little pressure on them. Less than 3 seconds. Left side, less than 3 seconds. Big toe, less than 3 seconds. Left big toe, less than 3 seconds. So cap refill are good. Like I said, extremities are good, no edema or anything like that. Now I'm gonna check for the different pulses, part of the body. So I'm done with the carotid pulse. I'm gonna go with the brachial pulse. Upon palpation, brachial pulse is +2, normal, no thrills. This is the radial pulse. I'm gonna do on both sides. So this is the radial pulse. +2 amplitude, no thrill noted. And this is the femoral artery. +2, no thrill found. And then this is the popliteal. +2, no thrill noted. And then on the inner, sorry, I'm just gonna make sure that you have the vision there. So on the posterior tibial, right here, right where the inner malleolus, like on the upper area. +2 for the amplitude, negative for thrill, and then the dorsalis pedis. +2, negative for thrills. So that is my cardiovascular examination. Thank you.